So welcome everybody to the Hidden Gems in Healthcare Medical Dosimetry presentation. And this is the agenda for today. We're going to have three schools talk about their programs. Suffolk University, University of Wisconsin-La Crosse, Grand Valley State University, and we have the pleasure to have a couple of current students and recent graduates to share their academic experience at these institutions and their career plans, hopefully for the future. Just one quick announcement, we still have a GRE free online practice test coming up on November 18th in the afternoon. You don't have to take it at that time. If you sign up, you're gonna have access to the test for 3 months. So that's all I have, and I will invite my first presenter to share her screen and start her presentation. And Jackie, take it over.
Okay, thank you so much. Let me share and let me know if you're able to see. Once I go into slideshow, are you seeing the thumbnails or are you seeing the one slide?
We're seeing one slide.
One slide, okay, perfect, thank you. So thank you so much everyone for joining. My name is Jackie Nyamwanda. I'm the program director for the Master of Science in Medical Dosimetry at Suffolk University. I also have the pleasure and the privilege of being continuing to work as a medical dosimetrist on a per diem basis at Massachusetts General Hospital. So it's my pleasure to be here today and to speak to you about this very hidden field called medical dosimetry. So let's see. All right. So first, I thought what I would do with this talk is just talk very generally about radiation oncology, and then talk about the role of the dosimetrist before then moving on to speaking about my specific program or our specific program. And I know that my colleagues from the other schools are also going to add more information. So I think this will be great. So what is radiation oncology? It's a medical subspecialty that uses radiation to either shrink or kill cancer cells. So primarily we're treating patients who have cancer, although we do also treat some benign conditions, but most of the patients we're treating are living with cancer. And so what kind of radiation are we using to target these cancer cells? We use things like photons, electrons, protons, and neutrons. And I hope this is exciting because I bet some of you have taken physics and you're wondering, when would I ever use any of this information? So the way we use radiation to target these cells is basically action on the DNA. And there's different ways of cell kill, primarily indirect action, but then there's also indirect action. So this image should be very familiar to everyone, the double-strand helix of the DNA. And so here's a photon coming in, and this is assumed this is a cell in the patient's body. And so it causes some indirect action, hydrolysis, and then on to damage the double strand. And then there's also others that happen directly. The timeline over which this happens varies, could be based on days, weeks, or months, and this depends on the type of tumor that we're working with. So here's what we call a linear accelerator. This is a machine in the radiation oncology department that produces the radiation that we use for treatment. So I'm primarily focusing on radiation that's being given externally. There's a different kind of radiation that's implanted into the body through radioactive seeds, but I'm not going to focus on that today. So here's a linear accelerator, and I've just shown you this image before of radiation at the cellular level, and yet I'm showing you this very big machine. So how does all that come together? How do we know what we're treating and what exactly is happening in the department? So radiation oncology works is a team-based profession. There's a lot of different role groups involved. There's a radiation oncologist who is a physician, medical physicists who are more involved with quality assurance and supervising the machines to make sure that everything is functioning correctly. There's a medical dosimetrist, which is what we're going to talk about today. There's radiation therapists who deliver the radiation. They're at the front line and see the patients on a daily basis. We have other role groups like nurses, social workers, nutritionists, engineers, administrative staff, all of whom are involved in making sure that the care process goes as smoothly as possible and that we are able to treat these patients. So what is medical dosimetry? We're kind of, not very many people know about dosimetrists for many reasons. One is we primarily work behind the scenes. I say mostly, but not exclusively behind the scenes. And what dosimetrists do is they design optimal radiation beam arrangements and calculate radiation doses. The ultimate goal of a dosimetrist's role is to deliver a prescribed dose of radiation to tumors or whichever area is being targeted, but also spare surrounding organs. And so here's a schematic showing some radiation beams coming into a model of the patient. And here we see some dosimetrists working in front of a computer. So this actually tells you that most of the work we do is computerized. We use a CT scan of the patient as the model on which to predict what the radiation will look like inside the patient. So this is a patient that I just worked on actually this morning. This is a patient with breast cancer. And so this is a CT scan of the patient. You can think of this as one slice sort of going across the chest in this direction. And so this is the anterior part, that's the sternum. These are the lungs, these dark colored areas. This is the patient's heart. And so this is where we're treating. It's hard to see, but there's a contour or an outline of the breast there. And this is a representation of what the radiation distribution looks like in the patient once we've done the plan. And so you can think of it sort of as a heat map or a dose map where we have different doses coming to the patient. You notice, so there's the lung, there's the heart. This is one of the arteries in the heart. And then here, this red thing is actually where the patient had a tumor that was taken out surgically. And now we're giving radiation to try and reduce the risk of recurrence. So you can see the quandary here. The dosimetrist problem is a very big part of our job is on geometry. Where should the radiation beam come from to spare as much as possible the normal organs? We can see that we're getting some dose into the lung. We cannot avoid it. We need to treat this area where the tumor is and the breast, but we're going to give some dose to the lung. There are posted limits through the clinical trials and historical experience that are tabulated. And so our job is to plan a radiation treatment to deliver the dose that the physician prescribed while respecting those normal limits. On the left side is basically a representation of what we're doing. This again is from the software system that we're using. You can see that this is that linear accelerator that I showed before. And this is a schematic showing this is a model of the patient, all based on the CT scan. So I'll want to go through just quickly the process of care, so you appreciate where the dosimetrist falls in the process of care. And I've color-coded these so that different colors represent different role groups, and you can sort of see what happens through the process. So initially, the patient would have seen physician, they would have had symptoms, gone in and been referred to a radiation oncologist. So they come in and see the patient, the radiation oncologist as part of a consult. And the radiation oncologist may decide to prescribe radiation if it's indicated. The patient then comes in to have what's called a simulation, or where the radiation therapist, now this is the other role group, will take a CT scan of the patient. After the scan is taken, the radiation oncologist will go to the next step, which is contouring, which means outlining the different areas on the CT scan of interest that we need to either radiate or protect. So the radiation oncologist is responsible for outlining where the tumor is, and the medical dosimetrist is involved in outlining where normal organs are. And so that's that step. And then once that is all done, it goes to planning, now this is where the medical dosimetrist does most of their work. The dosimetrist designs the beam angles that will give the best geometry to get to the tumors, and also calculates the doses. And once that is done, they then send the plan or work in collaboration with the radiation oncologist the radiation oncologist has to review and approve the plan. And this step has a little bit of negotiation. Your plan could be rejected. You are not meeting the requirements, or they want you to improve some part of it. And so there's a little bit of back and forth, interacting with the physician. If it gets approved, then you have to do some implementation, sending it over to the treatment unit so that the therapist can then can treat the patient. And in between that step, there's a very important quality assurance step where the medical physicist will check the plan to make sure that it's appropriate and that there are no errors. And once that is done, then it goes on to the radiation therapist. So you can see that it's quite a process. Where I've put these asterisks are areas where the medical dosimetrist may be involved. You may be involved in the CT simulation. You may also be present at the treatment, maybe if there's a question, or maybe it's a complicated setup. So we are sort of in the middle, and I like to think of dosimetrists as the architects of radiation therapy. We're the ones designing the treatment plan. So what attributes and skills do you need in order to be a dosimetrist? You need to have some knowledge of math, anatomy, as you can imagine from what I've shown, physiology, an understanding of radiation physics, so you know what kind of treatments or what kind of modalities you should be using for a particular case, clinical oncology and radiation biology. Should also have a technical knowledge of radiation oncology and medical physics. Very important is analytical and critical thinking skills. This is not a profession where you rely primarily on memorization. There are some things that we have to know and have at our fingertips, but you really have to think in the moment. Every patient is different geometries, different presentation. Attention to detail is very, very important. As you can imagine, we're giving radiation, and so making errors could have negative effects on the patients, whether it's the patient is over-irradiated or under-irradiated. You also have to be able to use computers for an extended period of time, and then the ability to visualize in 3 dimensions as well. And I showed a lot of cooperation and interaction with different role groups. So verbal and written communication skills are very important, as well, and then teamwork as well, to make sure that we meet the needs of the patients. So what do the daily responsibilities look like for a medical dosimetrist? As I said, you may be present during the CT scan. You then transfer images to the planning computer. You check them for accuracy, contouring or outlining of normal organs, designing the treatment plan, preparing the treatment parameters, performing and verifying the dose calculations, and collaborating with radiation oncologists, radiation therapists, and medical physicists. So on this image, I'm showing another patient that I did this afternoon. This is a palliative patient. So this patient is not curative. They have metastatic disease in the pelvis. And so this is on the right hip, basically. And what we're showing here, this is bowel, and that's the bladder. And so this is a patient that could have some side effects, for example, nausea or diarrhea if we over-radiated in this area. So that was just one example. So what does entry into the profession entail? In order to sit the board exam, which is given by the Medical Dosimetry Certification Board, you need to have have graduated from a JCERT accredited program. JCERT is the accrediting body for medical dosimetry programs. And that the MDCB also requires a bachelor's degree at a minimum. And graduating from a JCERT accredited program, which all 3 that are presenting today is a combination of didactic coursework as well as clinical rotations where you complete your treatment planning competencies. A little word about certification. This is required by most employers, but there is no federal or state requirement for certification at this time for the profession. However, most employers do require the certification, and so we do encourage our students to go on and sit for the board exam. And I'm just keeping my eye on the time here. So now I think I want to just move into specifically talking about the program at Suffolk University. We are located in Boston. We are downtown. We are based right in the middle of the city. So this is sort of a schematic to show where we are. And this is the Charles River. This is a picture of the university, and there's a beautiful park right very near the university in the Boston Common. So this is, we are a 21-month program, combination again of didactic coursework and clinical rotations. We do have a full-time summer rotation of 40 hours per week for 12 weeks. We accept students for entry in the fall only, and our students graduate in May. And right now they typically will sit for their board exam in September. And if that date changes based on the MDCB, then we adjust accordingly. We are a very small program. We take 8 students per cohort. But because we're a 21-month program, it means we have about 16 students at any one time. And we are a face-to-face program. And so sometimes I get applicants who want to have online didactic education. And so I refer them to another program, but we offer face-to-face instruction at this time. Our admissions requirements are a bachelor's degree because we are a master's level program. Students need to have at least a 3.0 cumulative GPA. Prerequisite coursework with at least C or better, and this includes biology, anatomy and physiology 1 and 2, physics 1 and 2, and calculus. We also require our applicants to have completed a shadow in medical dosimetry, ideally through a radiation oncology department near where they are, or we can also try and help secure a shadow here in Boston. Because of the COVID-19 restrictions, a lot of hospitals are not allowing visitors, and so we have developed a virtual shadow option available through the university, and that's part of the admissions process. So those who are interested are able to take advantage of that. So we are offering that just in these times of COVID. The application deadline is January 15th. We do require 2 letters of recommendation. Students write an essay about why they're applying to the program, what their career interests are, what their goals, their professional goals are. We do require transcripts, a resume, and then based on the review of the application, applicants may be invited to take a math assessment, which is very basic. It's taken without a calculator, just to see if people know how to make change basically at the supermarket. And also there's an interview as well with the committee. We do have some financial aid options. There are certain tuition discounts. These are merit-based and don't require a repayment, and they vary in amount. Again, it's all based on merit. We also have graduate fellowships. There is one program fellowship available as well, and then graduate loans. So one of the strengths of the program are our clinical affiliates. So our students complete their rotations at several hospitals in and around the Boston area. And this includes Massachusetts General Hospital and 3 of the satellites, Brigham and Women's Hospital and 2 satellite facilities. We have Leahy Hospital in Burlington and Rhode Island Hospital in Providence. And this is a map just showing where our clinical sites are. So this is downtown Boston. You can see most of them are located in a certain radius near downtown, and we have 2 that are a little bit farther out, but all are within driving distance of the university campus. So what are the program's strengths? I would say the small class sizes. Again, we have 8 students per cohort. So we get to know the students really well. We rely on, a lot of our classes are taught by adjunct instructors from the hospitals that I listed. So Mass General Hospital, Brigham and Women's. They're the clinical experts, they have current knowledge, and I think that really strengthens the program. We use experiential learning. Our students get about just about 1,300 clinical hours, and we place all the students. Additionally, our students get to do multiple rotations. So they do 2 rotations. One is usually at a large academic medical center, and another one will be at a smaller community center, one of the satellite facilities. And we adopted this model to give students exposure in different settings. You might have some preference one over the other. Students also get to learn multiple treatment planning systems or different software. So Eclipse and RayStation are the 2 major treatment planning systems in the market, and the students graduate with knowledge in both. The analogy I like to use here is it's like, think of being able to use a Mac and a PC really well, regardless of where you end up working. Another strength of the program is all students get a rotation in proton therapy. So proton therapy is a little bit more specialized, and it's becoming more and more common, I would say. It's growing in use across the country, and our students get a 3-week rotation, and that's offered at Mass General Hospital. The other strength that we have is at Brigham and Women's Hospital, which is one of our other affiliates, has an MRI LINAC, and so we're hoping that our students will get some exposure to that as well. And that's still fairly new, but I think that's something that we're going to involve our students in. The clinical rotations are competency-based. Students plan on, real patients. What I mean here is you learn how to plan on maybe image sets of previously treated patients, but then they also work on actual patients, and their plans are used for treatment. And we do follow the curriculum guidelines of our professional association, which is the AAMD. Students are assigned a preceptor who will work with them side by side and provide them instruction. And our evaluation is holistic. So we look at your technical knowledge in terms of your cognitive. We also look at affective, meaning your attitudes and behaviors, and then psychomotor skills in terms of how you go about doing the tasks. The curriculum includes a year-long course, which is chosen by the student. They're assigned a clinical mentor who's a subject matter expert in the topic that the student picked. And then students will have a faculty advisor from the university. We've had students present posters like the one I'm showing here. We encourage publication. We actually have some manuscripts outstanding, and our students also participate in the student writing competition, where we placed, I think, 3rd about 2 years ago. So what does the outlook look like once students graduate? Right now, the profession is seeing a little bit of a shortage in terms of qualified dosimetrists. Most of the students, at least in my program, and I think the same is true for the others, have been hired primarily before graduation. In our case, 100% are hired within 6 months of graduation. And the MDCB exam pass rate has been good for the program, about 95% pass rate on first attempt. This is a 5-year average. And we've been able to retain all our students for the last several number of years. So for this program, what should students expect? Rigor, fun, accountability, learning from peers, professional and personal growth. And I think for me, I will say this profession, it is very rewarding. Because everything you're doing is ultimately for a patient. You're doing something to help a patient at the end of the day. And so even in an example like this, which is palliative, you're still doing something that's very noble and I think very satisfying. And that is all I had for today. That is my contact information. If you have any questions, feel free to email or you can call that number, and I'm happy to answer any questions. So I am going to stop sharing and let me look at the chat. I see something.
Thank you so much.
Sorry,
it's okay.
I went over.
No worries, no worries. Thank you so much for the presentation. It was very interesting. And students, if you have any questions regarding this first presentation, please make sure you put it in the Q&A, because Jackie can see the Q&A and can answer typing. But just because of the interest of time, I'm going to move on to our next presenter. Nichelle, please take it over.
Okay. I'm going to flip-flop screens here after I share, so bear with me here. Are you seeing my full screen or my notes?
I see the full screen, I believe, or I don't know, maybe notes too. No, I see the next slide. Yes, I do see it. No, now it's good. Okay. Now it's good.
Okay. So I realized that Jackie's presentation is very, very similar to mine. So I'm probably going to skip some slides. But I am Nichelle Leonards, the director of the medical dosimetry program at UW-La Crosse in Wisconsin. And I'm just going to do a brief introduction about the profession and educational requirements before I move into our specific program details. So Jackie already provided this, so I'm going to skip over this because it's the same thing that she said. I am going to walk a little bit more through the process. I think Jackie had provided a flow chart. I'm just going to go into a little bit more detail. So the process starts with the physician, the radiation oncologist, who writes the prescription of radiation dose to that tumor volume, but also constraints, or let's say limitations, of what radiation can be delivered to normal tissues or organs. And the patient first starts in like CT simulation and setup. So they're going to be put into the best position for treatment to minimize movement. And they're gonna, the therapists are gonna construct immobilization devices, put marks on them. They're going to get tattoos, usually just like a drop of ink and a poke with the needle. And those are used for lining the patient up rotation wise, superior to inferior, left, right, kind of like a 3D coordinate system. And the dosimetrist is involved in this process sometimes, maybe in a assisting or in a supervisory role. And sometimes the marks are put on the positioning devices and patients don't get tattoos. So it just depends on the setup. The next step is contouring, and you know, Jackie went over some of this as well. And the physician and the medical dosimetrist spend a significant amount of time contouring anatomic structures on the CT. And actually, sometimes it's not even, it's not always just a CT that you're using, but I'll get into that here in a couple more slides. But the software that we're using has a lot of, let's say, artificial intelligence type things, a lot of automated functions to help us work more efficiently. And an example of that would be like on this screen where the dosimetrist might go through contouring structures, maybe every other slice, and then there's some interpolation that happens to contour all those slices in between, and it just improves the efficiency. Obviously, we still have to review all of it, edit for accuracy and that kind of stuff, but it's just a way to you know, I guess speed up the process a little bit. So for this is just an example of contouring, just so that you get an idea that it's not just like the tumor or the cancer area. There's a lot of stuff that you have to contour depending on the area that you're treating. So this might be this is a brain case, and so you have, you know, the eyes you have to contour, the lens, the optic nerves, optic chiasm, you know, normal brain tissue, the contour of the patient. So it goes on and on. There's a lot of things that you have to contour. So when I was talking about imaging studies, sometimes you can't see everything that you need to see when you're contouring on a CT scan. And so you use other imaging studies that help with that. And for an example, like on the chest or lung patient, you want to see all that microscopic disease and like nodal volumes. And so you might fuse that with a PET CT, a PET scan. And so what the physician is able to do is they're contouring on the CT, but they're actually using the PET sort of like underlay or overlay to see the real extent of the disease. And so you're basically fusing two imaging studies to do that. The other image in the lower right, it would be an example of a brain case where the brain tissue doesn't show up as well on a CT scan. And so most of the time they're going to use an MRI scan. And so you can see the differences on the left, the CT, and the MRI on the right. And so that's commonly a fusion study that you would do in order to contour better with the brain patients. But again, like we are planning with the CT scan. So for treatment planning, this is also, I guess, the physician and the dosimetrist spends a significant amount of time with treatment planning, because after you get done with all that contouring, like Jackie was talking about, there are multiple plans that you're going through to try to get the best plan for treatment. And you may go back and forth. You may plan for 2 hours, you may plan for 4 hours, you might plan for 2 days. And so this is the time where you are spending a lot of time looking at the different beam angles. You're looking at everything that you've set up with like all the structures and how much dose can be delivered and et cetera. They're looking at dose volume histograms and also, you know, isodose lines. They're looking at percentages of radiation being deposited in certain areas. So this is where that analytic skills comes in, or the problem solving skills, because you're looking at a bunch of stuff in the treatment planning system all day long. Oh, and the other thing I was going to add is that this is, you can tell from the images that that's where that three-dimensional, having the three-dimensional concept. So if, you know, you don't really care for cross-sectional anatomy or anatomy in general, this is definitely not the job. So after planning, the medical physics, they're going to check plans, dose calculations, do any necessary checks before that first patient treatment. And then again, the medical dosimetrist is going to check and assist the radiation therapist during that first day setup, as well as any time after that, let's say they're troubleshooting or need to do additional calculations and things like that. So I had this about the skills needed, and we already went over that with Jackie, so I'm going to skip that. A common question we get asked is, how much patient interaction does this involve? And the interaction is not daily. Again, it's specific to certain phases of that patient going through, you know, setup and first day treatment and throughout treatment. So, but the dosimetrist must be knowledgeable with patient care. They are in a patient care environment. They are working with patients, and they have to understand the ethical issues in the profession as well. And what I usually tell people is, even though we're behind the scenes, dosimetry actually has a major impact on patient care, because that treatment plan that they design not only determines the best chance for survival, but it also decreases side effects. And it determines like not only how many or how much side effects they're getting from the radiation, but also how severe. Not just short term, but also long term. So it's just important to really remember that you might not be seeing the patient every day, but you do have a major, major impact on that patient treatment. The typical day, Jackie went over this, so I'm going to skip that. Other than, I was going to say that I would say contouring and designing the treatment plans is probably the bulk of what you're doing all day long. The other things obviously important, they just wouldn't take up maybe as much time as your contouring and designing the treatment plans. So let's talk a little bit education requirements. So some programs only accept people who are radiation therapists. Other programs accept bachelor degree candidates as long as it's in the physical sciences, or at least you've met all the prerequisites that, you know, that are mostly science-based. Generally, you're going to need biology, physics, a calc, trig level, math, chemistry, anatomy and physiology, and medical terminology. You'll most certainly be interviewing with an admissions committee, and selection is competitive. Some programs recommend observation and dosimetry, some require it. Our program specifically requires it still. I have the link down here about for our program application, but if you Google our program, you'll find the admissions information. There are 16 accredited programs in the country right now. Some offer a certificate, some offer a bachelor's degree, and some offer a master's degree. And some programs offer more than one type of degree. Distance learning is an option at several programs. Back in 2003, when we started the program, we were the first and only online program, and that was the case for several years, which allowed us to have clinical sites all over the United States, so people didn't have to try to relocate. Now there are other programs that offer a distance learning option. Some are hybrid, some do a face-to-face and a distance learning. Ours is online only, so there's no requirement to come to campus. Programs have to be accredited by the JRC-ERT for the graduates to sit for the national board exam and become certified, and that exam is only offered twice a year by the MDCB. And as Jackie mentioned, the future job market is strong. There's an overall shortage in the profession. Obviously, there are certain regions that have a greater need than others. Jobs are available in rural and urban settings. Pretty much anywhere radiation oncology is at, you are going to see dosimetry jobs. And advancement in technology has increased the demand for medical dosimetrists. The salary range vary throughout the country. According to the AMD salary survey, the ranges that I've got posted are kind of generalized. The lower ranges are going to be the Midwest. Some of these you're going to get paid higher if it's an area where it's difficult to recruit, or even if there's like a high cost of living. Typical employers, the first four listed are kind of those typical, what you would work for, various options, community, private healthcare systems, etc. You can also do locum tenens. You can work for a vendor and teach like applications. Some junior medical physics positions hire dosimetrists. You can do research or protocol work. You can also hire yourself out as a contractor. And some people ask about advancement. When you're in dosimetry, you can do lead dosimetry jobs. You can do chief of dosimetry. You can be the manager of the department. Sometimes those managers go on to other hospital administration jobs, like maybe administrator of a cancer center. You can work in education, like us. You can do research. And some people go back to school for medical physics. Generally, it's a Monday through Friday daytime job. Some people are paid hourly with overtime, others are salaried. Only about 5 to 10% of dosimetrists are part-time, and many people work from home, especially in a post-COVID environment. Prior to COVID, there were some cancer centers that allowed the dosimetrists to rotate. One person would stay in the clinic and others could work from home, because we have the ability to access that treatment planning computer remotely. When COVID happened, nearly everybody was working from home. And now that seems to be a common theme when people are posting their job ads. They're saying hybrid, work from home a third of the time, or work in the clinic a third of the time, if there's 3 people rotating and stuff like that. So that makes it even more desirable to work in dosimetry when people know they have that flexibility of working from home as well. For our program specifically, it's a 16-month program. The first fall semester is online classes only, and then the second through 4th semester is online classes plus that 12-month clinical internship. Our students graduate in December, and then they take the exam the following year in September. We have over 100 internship sites nationwide. I would say we're probably one of the bigger programs. There's a handful of us that have a lot of internship sites. We establish new sites weekly, and obviously the benefit is if you have a clinical site in your area and there's not a program, then it helps to affiliate with a program, and that's how we establish new sites. Ideal applicants have completed their prerequisite at the college level. They've completed more than the required hours of dosimetry observation. They have patient care experience, whether it's paid or volunteer. 3.0 cumulative and a science GPA. We put a lot of weight on the science GPAs because of the research that I did showing that people who struggled through the dosimetry program or had to drop out of the program had lower science GPAs, and those that did not pass the MDCB exam also had lower science GPAs. It is a competitive admissions process, and I guess just to give an example, that if you're a program that has close to 100 applications, but you're only taking 25 to 30 students, that's, obviously very, very competitive. Our application deadline is in early January. The only reason I didn't give a specific is because it changes a little bit based on when these days fall on, our admissions person just changes it. It's like a Friday, like after week 1 in January or something. There's 4 letters of recommendation that are required. The observation and dosimetry is required. There are essays, 3 essays that have to be written, and then obviously the transcripts have to be submitted. For the interviews, you can pick a certain number of internship sites, and you can interview at those sites. How students are placed is sort of a match program. The students rank the sites they interviewed at in order, and then the sites that interviewed all the different students will also rank them as well. And we try to place the student where they ranked high and where they want to be. So we offer internship placement, and if they accept, then it's typically 1 student placed per site. We do not recommend working during the program because this program is only 16 months. It's graduate level. You're taking more than full-time coursework, and people who try to work at the same time do not do well. Our program effectiveness data is I think most of the programs are pretty similar. We have a 100% employment rate, 100% retention rate, about a 96% exam pass rate. My stats for this year aren't calculated into that quite yet, and I suspect that's going to go up. I would say one of the strengths of our program is we have a significant number of research publications from our program. The students are working on a research/thesis project, and we have a lot of publications from our program. So these are important links. The AAMD is the professional organization. The MDCB is the board exam. JRC-ERT is accreditation. And then I have our program website listed at the bottom. And if you have questions, for me, I'm the program director, and my email's there. If you have clinical internship specific questions or interested in affiliations, it's best to reach out to our clinical coordinator, Anne Marie Van. And for admissions, it's best to go directly to Peter Ammon. He is our health professions admissions person. He does this every day specific for our program, and he's the one that can answer all of your questions regarding admissions. And that's all I have.
Thank you so much for the presentation. And if students have any questions, please put it in the Q&A. You had 2 great questions for Jackie. So thank you for those, and keep putting your questions in the Q&A. And I'm inviting Kristen to present her program.
All right, thank you very much. My name is Kristen Vu, and I'm the program director for Grand Valley State University's medical dosimetry program. We also offer a master's degree. And I wanted just to start, Jackie and Michelle did a great job explaining what medical dosimetrist is. It's a very hidden field. No one knows what you do. If you introduce yourself, they will kind of give you the look of, oh, that's great. So we always have to explain what we do. I thought I would just share a little bit about why I love dosimetry. I started in the field in radiation therapist. So I went to school for radiation therapy, and that's how I came across medical dosimetry and really fell in love with the intricacy of it. We don't have that patient direct contact, but we're still very much an advocate for our patients. And what we do in the treatment planning is a really important part of that's going to determine, if their treatment is effective, what kind of side effects they're going to incur. So we really do play a really large role in their treatment, but they just never see us. So if you don't mind being kind of behind the scenes, then this might be the job for you. So I really love that it's a very well-rounded field. As you see, we do a lot of things with anatomy and physics and radiation physics and knowing some, about the biology. You really get a good kind of roundness to what you're doing. You're not just an expert in one specific area. You really have to know quite a bit about everything. A lot of times you'll kind of hear us say that we are in the center of our radiation oncology department, where we have to be able to work with a radiation oncologist and work with a radiation physicist and be able to communicate with a radiation therapist and, deliver the treatments that we're creating. So it's kind of good. I found myself when I went to school didn't know exactly what I wanted to do because I didn't have a great interest in one specific area. So this was a good opportunity for me to be able to explore and kind of get a touch of multiple different areas. So for our program specifically, I'm just going to kind of go into that, and then we'll look at a little bit of treatment planning just to kind of give you an idea of what the software looks like. So we have a 12-month online hybrid program. We're JRC ERT accredited. Our program starts in the fall. So we start our students in September, and then we go through August and they graduate. And then we start the next cohort, usually right away, about a 3-week separation between them. It's 38 credits. So that's the combination of didactic education and then clinical education. So we're considered also a hybrid program, not fully online, because our students do come to campus once during that 12-month program. So they come for orientation. They're on site in Grand Rapids, Michigan for a 3-day visit where we do a whole bunch of things. And then they go to their clinical sites, which are located all across the United States. And then they do all of the remaining didactic coursework fully online. So they live near their clinical site, they stay at one site, and then do the didactic coursework online with our program. It's a very rigorous program. Ours is 12 months. We have a part-time option, which can slow it down a little bit. But one of the questions was, what are the prereqs? What kind of degree do you need to have? Because we're talking right now about our graduate programs. And so it really depends on how the program was set up. So historically for dosimetrists, it was on-the-job trained. So we would take radiation therapists that did really well and then cross-train them into dosimetry. So just bring them into the dosimetry room, sit them down, start teaching them what we knew. And that's how they became a dosimetrist. We then went to more formal education, and then with the boards, the eligibility changed to you have to graduate from a JRC ERT accredited program. So we've started to see that shift. So some of our programs like mine are really built on their curriculum, the clinical experience, that those students have a robust knowledge of radiation oncology and what radiation oncology therapy really is. So for our program, that's our students are mainly radiation therapists. Our program happens to be that we've kind of just gone down the route where we have a lot of adult learners where they've worked as a radiation therapist for many years, and now they're going back to school to go into dosimetry, or they've just recently graduated from a therapy program. And so we'll talk a little bit more about a route if you don't have a therapy undergraduate degree. And then also, we put the JRC ERT link in here, but you can see the other medical dosimetry programs that are offered. So there's the list here, and then you can see there's different degrees that are offered too, and they all have different admissions processes and requirements. So if you're looking, this is a great place to start. So here's just a quick look at our curriculum. We have a stats course, and then we do, really dosimetry specific courses called treatment planning. Our program, we have a lab course, which is unique. We have a non-clinical Eclipse, which is our treatment planning software that we use specifically for our institution that's not connected to like a hospital system. So we will have lab courses where we have an adjunct. We'll do demonstration of like how to do a left breast plan. And then the students are able to create that plan in their software system, and then the instructor can review it and give them feedback. So we help support our students while they're in their clinical education by giving them a different perspective since they're not rotating to different sites. The other really nice thing is that we have some technology that the students may not be able to get during their clinical rotations. And so then we can do things like specialized proton treatment planning where the students can do that in a lab environment. The students are in clinic throughout the entire 12 months. And then we also have the research project, which we'll look at in here as well. So the online courses, so we use Blackboard for our learning management system. We set it up in weekly modules. So it's very much like if you were in person. We really try to make sure that the online education portion of our program is very robust. So we do things like weekly modules where there's recorded lectures, along with a PowerPoint, there's assignments, and then we do also synchronous classes. So we have our students meet online once a week for an hour, to meet with their instructor so that they can ask questions, and it's the time for discussion and a little more in depth, or go over homework questions that the students might have struggled with. And then we have some cool technology like the light board, where we can have it look like I'm right in front of you and writing and showing math problems and that type of thing. So here's just our treatment planning labs that I talked about before. So you can see here's an example from a recording that we did, where we're walking through how to create that treatment plan for the students so that they can recreate it. So since we're an online program, our clinical sites are all across the United States. Clinics, our students for full-time option are in the clinic 4 days a week, so 32 hours. So it's a very rigorous program. It takes a lot of time. They're not only in clinic for 32 hours, but then they're also doing, another 8 to 9 credits of didactic coursework, which is quite a heavy load by itself for a graduate program. So it is short, but it's very intense. Couple things, you can't get paid by your clinical site while you're in clinics, and that's across all JRC ERT accredited programs. That's one of the regulations. Our program, we do allow our students to be employed by their clinical site, so it's a little bit unique in that sense. Especially our part-time students are typically working at the clinical site, so we just work very hard to separate when they're a student and when they're an employee, since there's different requirements during those times. It's competency-based program. So for clinical education, which is the majority of our programs, so there's a list of competencies. So for example, whole brain. So students in the clinic will learn how to do that, be shown how to do it, they'll practice, and then have to be able to perform that task in order to pass that competency. Our students do a research project. It's a 1-year student-led project. They're having a research project advisor assigned to them. And what they're really doing is creating basically a paper that's at the level of a publishable journal article. It has to be an original project. And so they get support through modules and things like that. We do have some alternative options for our program. Our part-time option, we usually get quite a few of these. So our cohort size is typically around 20 students right now. And so we usually will have anywhere from 3 to up to 8 of our students being the part-time option, where they're working as a radiation therapist. So we allow them to do their clinical education slower. So they can do a minimum of 16 hours per week instead of the 32. And they do all their didactic courses though on schedule in that 1 year with a cohort, and then they just finish up their clinical hours. So this is nice for people who can't, quit their job if they're working as a therapist to go back to work or go back to school and not get any type of financial support from working. We also have a professional learning policy. So for those radiation therapists that might have been on the job trained, or sometimes there's roles like medical dosimetry assistants, where they're learning how to do the skills of a dosimetrist, but they don't have that didactic knowledge. What we have is a program that they can basically get college level tuition, or sorry, college level credits for that professional work experience. So that's really beneficial to them. So they can get some college level credit basically for those courses, and they don't have to pay that extra tuition. And that's just for those clinical education courses. So our admissions is applications are due by February 1st. We let our applicants know by March 15th what their status is and what their clinical site location will be. We look at academic achievement, so the GPA. So we weight that. A minimum overall 3.0 GPA is required. There's prerequisite coursework. So those are radiation therapy courses, and they have to fill out a prereq course completion. Healthcare experience is required. So 40 hours of healthcare experience or 8 hours of medical dosimetry job shadow. And then they have to submit a resume, 3 references, and then write a personal statement. So we try to look at our application pool a little bit holistically and not just focus too heavily on that GPA. We really want to make sure that we get really good, well-rounded students. So here's just the considerations, which is what we mentioned before. We do have an interview process, so that's part of it. And then we also take into consideration like additional leadership, employment, professional, scholarly, extracurricular activities. We take that into account. So for those with a non-radiation therapy background, for our program, this is just how we do it. Since we're not really set up to take non-therapy background students, we do allow students to still apply, and then they can do what we call like a conditional admission. So they would already have a bachelor's degree. They might have some of the prerequisites, but not the radiation therapy ones. So if they get accepted, they can start in the program, and it kind of changes it into a 2-year program. They have to take those radiation therapy prerequisite courses through Grand Valley's radiation therapy program, which is a bachelor's degree. So they have to take those specific courses. But those are only offered in seat at Grand Valley in Grand Rapids, Michigan. So that can be a limitation for some students. But if they finish those courses in those 2 semesters, then that following fall, they would be able to start the dosimetry program. And then that would be convert to like a full admissions. So that's how we do it. We only accept about anywhere from 1 to 3 students through this method because of the size limitation of the classes of our radiation therapy program. And so I wanted to leave you a couple of resources if you guys were, kind of thinking that this is a really interesting topic, something that you might want to look into further. These are 2 good ones that I like for my students. It's called econtour.org and then pronosystems.com. And so if we look, this is the Prono one. So we do a lot of contouring anatomy. And so I opened up one of them, and what you can do is you can contour and practice that. So this would be a bladder case, and there's tutorials and things like that that go over it, but it's you can actually slice or scroll through the CT. You can do the contouring and create that. And then what's really nice about this, it's a learning tool. So you can say I'm finished. You can generate a score. It will generate a score and then also show you what the expert has contoured it as. And you can see where you missed it, what was incorrect about it, where you overlapped with that expert. So it's a good learning tool if you're trying to learn anatomy or interested in dosimetry. eContour is a really nice, great website. These are both free for you to sign up for. Really easy process for that. But this is a really great one where there's different cases that have been contoured with normal tissue structures. So things like you can scroll through the CT here, like the eyes and the lenses are contoured, but also things like this is a brain tumor. So you can see and you can turn off the different structures to get a better sense of where they are. And they give some explanations about like prescription doses and things like that. So that's a good website. And then I wanted to show you here in the last minute, this is our treatment planning system. So there's different vendors. So this happens just to be Variant Eclipse. And so this is what we spend a lot of our time in. So this would be for a breast cancer patient where they've had a lumpectomy, and the physician, the radiation oncologist, would delineate where that tumor is. And then as the dosimetrist, it's our job, to figure out how to deliver the radiation. So we have these tools where we can change like the angle of how the beam is coming in. We can define where the radiation is going to go by using like what we call our jaws here, which would be solid being blocked for that portion of the radiation. So we can define where that radiation should go. You can then contour things like the heart, and you can see, then you can see where the heart is when you're creating those fields. So we want to make sure we would block that and not include that in our field. So here's the plan that's been created for a left breast patient, where you can see we have the isos lines and you can turn those on and off. So we have a lot of freedom. And this is where we do all that planning and are able to visualize where the radiation dose is, where the measurement is going to be. We can see things like a dose volume histogram. So we can see how much dose the heart is receiving from this area as well. So that's just a quick overview then of what our planning software looks like. And we spend a lot of time during our day in this system. So thank you for your attention, and hopefully that sparked your interest in dosimetry.
Thank you very much for your presentation as well. And before I introduce our students, I can't wait to hear from you guys too. I want to ask one question. Is any of these programs on rolling admissions, or are there any benefits from being an early applicant? Because that's a lot of the time the questions I get.
Some programs do have rolling admissions. Like my program will fill the cohort, but if we have open seats, then we will continue to take late applications. But I would say overall, applying early and on time and making sure that everything's completely in there, like all your transcripts have been sent, that type of thing is going to be important.
I agree.
Thank you. Yes, Jackie?
It's the same for my program. We have the January 15th deadline, but we will take, if we have space available, which doesn't really happen much anymore, we'll take applications until April 1st. But the other reason why we encourage early application and on that deadline is for the financial aid for the tuition grants. So if you apply later, then there might not be anything available.
All right, so thank you so much for that. And now I want to invite current students, recent graduates to introduce themselves. So I'm going to start with Caitlin, since you are the first one on my screen.
Hi, I'm Caitlin Allen. I'm with the University of Wisconsin, La Crosse. I am based in College Station, Texas, and I'm graduating hopefully here in December in about 5 weeks.
Okay, Katlina.
Hi, I'm Kathlina, and I went to Suffolk University. I graduated in May 2021, and I currently reside in Salt Lake City, Utah, where I've been a dosimetrist for 1 month. But before that, I was living in and practicing as a dosimetrist in Montgomery, Alabama before that. So I had 2 different kind of clinical roles and very different situations.
Thank you. Paige.
Hi, I'm Paige. I'm also enrolled in UW La Crosse, and I'm doing my clinical rotations at Gunderson Health System in La Crosse, Wisconsin.
Matthew.
Hi, I'm Matt. I went to Suffolk University. I just graduated in May. I'm now working at the University of Vermont Medical Center.
Thank you so much for being here. Students, if you have any questions, please keep putting them in the Q&A. And while that happens, I have 2 questions. First of all, how did you even learn about medical dosimetry? Because I came across it by accident, never heard about it before, and I'm pretty sure many of my UCLA students don't know what this profession looks like. So how did you discover it?
I can go first. So I discovered it because I was a non-traditional student. So my bachelor's degree is in marketing, which, as all the program directors talked about, you should have a strong science background, and I did not. So I had to go back to school to get the prerequisites. In doing so, I was discovering different types of jobs. I looked at PA, NP, cardiac perfusionist, and then I stumbled upon, like everyone does, stumbled upon dosimetry. And so I reached out, I found the program, I found Jackie's contact information, and I've really enjoyed it. And what really stuck out to me the most about dosimetry versus the other professions is how quickly it's changed and how quickly it's developing and how new it is. So it's very exciting, and I'm very happy I found it as my career.
Anyone else would like to share?
Yeah, I can talk about it. It's actually interesting that Kathleen just said that, because I honestly shadowed every medical job under the sun and didn't want to do any of them. So then I just started Googling things along the lines of medical jobs that no one's ever heard of, and it ended up being a coin flip between dosimetry and cardiac perfusion, which is another thing that no one's ever heard of. But that's why I thought it was funny that Kathleen said that. But I chose dosimetry because I didn't necessarily want to be on the front lines. I wanted to help people, but I didn't know if I had the mental capacity to be with patients directly every day, all day. So I went with it, and I love it.
Great. Kathleen, Paige, any of you would like to add?
Yeah, so I was actually working as a medical laboratory scientist for 4 years in a genetics lab at the Mayo Clinic. And when I got that role, I was assigned to the side of the lab that looks at genetic abnormalities in cancer patients. So from there, I got interested in cancer treatment, and that kind of led me down the road of treatment planning and then researching graduate programs. And I found the UW La Crosse website, and kept researching it from there and got interested and enrolled in the program.
Nice. Caitlin?
I went a little more traditional, I guess. I found radiation therapy through a similar thing to this meeting, through an allied health program at my school. Shadowed, went into radiation therapy. I worked as a therapist for about 12 years before deciding that I wanted to go back to school. And I was fortunate enough that my employer offered to teach me. So I kind of went into medical dosimetry to learn a little bit more, get a different aspect of the job. And also it kind of opened up an opportunity to be hybrid, which was exciting to me, to be able to do some work from home, still get patient interaction, just not as much as I had.
So it's been talked about it in the presentations of the skill set that you will be using in this profession, but what is the most exciting thing about your job? What gets you up in the morning to go to work excited?
I can go on this one. Oh, go ahead.
I really enjoy how there's more than one way to do something. So you have different techniques that you can use. You have different tools in your tool belt. And then there's even more software coming out that you can use to get the same thing done. So for example, ClearCheck, EasyFluence. I love it. I use it all the time. And I know for new students that are on here right now, you might be say, I don't know what that is, but for my dosimetry colleagues, that's the example that I'm thinking of that really I enjoy in my line of work, is just new things.
Caitlin?
I can mimic that exactly. I think this profession gives you an opportunity to learn something new every day. No patient is the same, no treatment is the same. You have an opportunity to learn something new pretty much every time you go into work. And then there's also healthcare evolves with technology, and we're getting new treatment planning systems, new machines, new things that you can learn about, be on the front line. It's really exciting to kind of work in a fast growing field, I guess.
Matt, Paige, anything to add?
Yeah, mine's along the lines of learning as well, but I really enjoy learning things that I don't necessarily need to know for my job. My doctors are fantastic teachers, and just learning about the biology and why they make the decisions that they do. I just love communicating with people who are in my field but don't have my job, and just extending my knowledge, and then you can kind of piece together what you know with what they told you and just discover something new that's been there all along. It's cool. You like you said, you learn something new every day, whether you need to know it or not. It's awesome.
This is my learning curve here, right here. Paige?
Yeah, I agree with what everyone said. I also think it's very interesting that you're always challenging yourself in dosimetry. So you can create a plan that's perfectly acceptable and could be treated, but you can always challenge yourself and ask, this is a great plan, but can I do even better? What can I do to spare the heart or the spinal cord or other important organs to create the best possible treatment plan for the patient? And everyone is very collaborative and teaching each other tips and tricks and advice. And you can always learn more and do even more. So it's a great field to challenge yourself and know that you can continue to learn and grow in.
So now we flip the script a little bit. What do you find most challenging about your job?
Yeah, I can talk about that first. It's nothing to do with what you're taught in school. It's just the hospital specific guidelines. It's after you're done with a plan, how do you document it, and how do you bill things, and how does one doctor like things compared to another doctor, and which physicist is late today? I don't know. I just started. It's just getting used to what's specific at your hospital for me.
Mm-hmm.
I agree. And I hope that some of the students that are watching, not a lot of us know each other, but this is how it is in dosimetry where I work. We all get along, we're all laughing, we're all having a really good time. So being a dosimetrist is a really good thing, and really fun job. But yeah, the kind of negative about it is, yeah, it's the paperwork part. It's that kind of part bugs me, but it has to be done.
It sounds like it's a team work. So I'm sure all of you really like working in a team. So how is that looks like in your role? Who do you interact most? Who you have to get along most with?
I think I interact the most with my fellow dosimetrists. And now some clinical sites, you could be the only dosimetrist, or you could be one of 25 dosimetrists. So just so you know, when you're looking at careers and different jobs and stuff, that is a possibility. And then the second most interactions are going to be with the physician and the physicist for the other interactions.
Yeah, one thing I really like about my job at UVM is we are completely in person, which might be a turnoff to some people, but as a new dosimetrist, I love it because during my whole clinical rotation, I would finish a plan, I would email the doctor, and then they would email back, okay, or good to go. And every time I finish a plan here, the doctor comes to my desk and we review it and I can defend it. So it's nice. I interact with the doctors every day, interact with the physicists every day. And I mean, I think it's great to start out somewhere where you could each get a little bit in person to start off right after school. It's helped me a lot.
Anyone else? Paige?
Yeah, I agree that it's nice at my clinical site that a lot of the people are in person and you get to interact with the radiation therapist too and observe treatment, which coming from not being a radiation therapist first has been really interesting and helpful to see the treatment delivery. And then a lot of the dosimetrists at my site do work remote about half time, and UW-La Crosse's program is fully remote. So tools like Microsoft Teams and Zoom and even Discord have been really helpful. And as a student, I was somewhat intimidated to not have face-to-face interaction with my classmates, but we found a lot of great ways to communicate like Discord and still have virtual study groups and stuff. So if things like that intimidate you, just know that it has been pretty easy to adapt to that remote style of communication too.
Some of my students tend to be concerned about work-life balance when it comes to healthcare careers because they are demanding, they are emotional. Some of them are very time sensitive. You have to be there for your patients. So how do you think medical dosimetry works with other life plans that people may have?
I think that dosimetry is a little bit, it's not all hands off. You do, like everyone's kind of said, there's in-office things that you do, but Monday through Friday, 8 to 5 is a typical work day. Like Michelle mentioned, it can go into the evening sometimes, but the unique thing about medical dosimetry is that you don't have to be at the clinic necessarily from the very first patient to the very last patient of the day. That was one of the challenges I faced as a radiation therapist, which I love treating patients, but having a life outside of that when you're very dependent on people coming in and going. I think medical dosimetry has a little bit better of a balance, work-life balance for that reason.
Yeah, in my clinic, we have an early person and a late person, and it kind of shows the teamwork of the dosimetry team because all together we've decided who will be the early person and the late person on that day. And so the late person gets to come in at 10 and leave at 5:30, and the early person's there at 6:30 and they leave at 3. So the teamwork of the dosimetry gets in with that, and then it's wonderful. You get to leave work at 3 p.m. and go home.
Yeah, I just want to add that pretty much the only time that you would have to be there that's not during normal work hours is this has happened to me multiple times recently, but it usually shouldn't happen much. It's just there's someone who needs a palliative care. there's someone who has a bone met and it's Friday and it's 3:30 and they need to be treated either that day or the next day, then you have to stay and you have to do the plan. But that does not happen often.
That's great to know. And so some of the schools require shadowing, some recommend shadowing. Is there anything else that you would recommend students to do to make sure that this is the right thing, the right profession, the right career for them?
I would recommend that you actually shadow a physicist, a therapist, a physician, in addition to a dosimetrist, to make sure that this is the career you want. And then if you wanted to go bigger, you could, like the route I did of PA, NP, cardiac perfusionist, shadow as much as you can. So before you spend one penny on your education, you know that this is the career that you would like to get into.
Anyone else would like to add something to that?
Yeah, I'll just say I didn't know what medical dosimetry was before researching graduate programs. So if you can get in contact with a student or a practicing dosimetrist, just talking to them even informally, kind of about the life-work balance, what they like and dislike about their job. It's very helpful just to kind of hear people's firsthand experience too.
Yeah, we do recommend informational interviews for any student who is looking for any type of career options. So it's a great way to get to know people and to get to hear their firsthand experience in a job and how they decided on a job. So before I close out, this is always the last question I ask, is any advice that you would want to give that you would have been very happy to receive when you were looking for your career options to share with our students? So what would you like to say to them that you would wish somebody would have told you when you started on your career exploration?
My advice would just be to network. And I did get that advice, and maybe I didn't take it, or I did, but if you're seeing one of our names right now and you say, I really want to reach out to Caitlin or Matthew or Paige or me, Kathlina, I would say jot our name down, find us on LinkedIn, Google us, and I would say network if you have further questions. Or the 3 program directors as well too, which are excellent resources.
Anyone else? Matthew?
Yeah, I would say, because when you're applying to these things, you're probably juggling between a few options. I would say whatever you choose, most likely you're going to learn to love it. Once you're in there and that's what you're studying every day and that's what you're doing, you like things more as you know them more. As you gain more knowledge about that, you're like, oh, this is pretty cool. So don't think that this is one snap decision and then your life is over because you're gonna hate it and you should have done the other thing. It's gonna be okay. You're gonna learn to like it, I promise.
Jackie, Michelle, Kristen, would you like to share anything else as regarding admissions? Like, what do you recommend students to do if they decide to pursue a program? What type of advice would you give someone who this is the first time they heard about this field?
Mm-hmm. I would say, well, definitely the shadow, which we require, but in terms of the application process itself, I would say it's very important to read the instructions carefully and to, and submit what was required. I also recommend that students get reference letters from people who really know them well and will write a good letter. Sometimes we get an application and it looks like a strong candidate, and I get a recommendation letter that you can tell the person barely remembers them. They were great, and that's like 2 lines. And that, all these things factor into the application. So paying attention, following up, We do know that students are applying to multiple programs and we encourage that, but sometimes I get a letter of recommendation addressed to University of Wisconsin, La Crosse or Grand Valley State from, so that happens. So that's on the recommender, but sometimes I see it in the personal statement as well. And there's nothing wrong with that. We encourage students to apply to all the programs. We all collaborate with one another, but paying attention to every portion of the application. And I think the last advice I would say is make sure you're doing something that you can envision yourself doing every single day, because you're going to have to wake up every morning and go do that thing. So to me, that's the most important thing, and being true to why you're applying to this program, why you're picking this profession, because it's it's patients' lives at stake. So attention to detail in the application process, I think, is my big one. That's it. Thank you.
One thing that I would mention is a lot of times that people apply, and even though we have the prerequisites listed, once we go through transcripts, we see that they're missing. Maybe it's not the higher level math that they should have, or they took we require like a 2-course sequence in anatomy and physiology and in physics. And so maybe they took like, 1. And so I think that's the other thing is be prepared. Like if you look at the prerequisites and you need all that, just go ahead and start taking it now. But I think a lot of times people apply and then it's missing, and now you've wasted all this time when you could have, completed those. And then the other thing that I was going to mention is I know someone had said something about, I just lost that. I'm sure it wasn't that.
Thank you, Kristen. Last minute advice.
Yeah, I would just add, if you guys are still in your undergraduate and you haven't graduated yet, right, you're still trying to figure out your career path, I would definitely kind of shadow exactly what Kathleen has said. Shadow radiation therapy, physics, oncology, dosimetry. See what you think would fit best for you, but you're also still in your undergrad, so you have options about what you want your bachelor's degree to be in. So look at the JRC website. Does it make sense for you to get a radiation therapy degree and then go to a master's in dosimetry? Does it make sense for you to, you're in your last year, should you get your general science degree and then go, look into programs then that would accept that degree type? So definitely look to see where you're at in your personal journey to see what would fit best for the path that you're currently on, because we all do have very different programs, right? There's certificate programs out there, bachelor's degree programs. I'm not saying you should leave, but right, you could quit what you're doing right now and then go to a bachelor's degree program in dosimetry. That, that's an option for you. So I forgot to share my contact information that is there. But I know all of us program directors probably do this. I get phone calls from students who aren't they want to go into dosimetry, and we advise you not just you need to come to our program, but we'll give you that general advice of what are your options, what can you look at, where are your resources. So I think any of us program directors are willing to help you and talk through, your personal options, connect, because that can look different for, a wide variety of students.
Thank you very much for all of you for being here. I'm going to stop recording.